Okay, so we have 17 or 19 participants at the moment. So maybe we can start. Good afternoon again, everyone. So welcome to the last lecture for this series. So the title for the lecture today is Staying Physically Fit During a Pandemic. We will have two speakers for today. Our first speaker is Dr. Christian Flores. So you know him already. He was the first lecturer for this series, and he talked about the impact of COVID to our health. And our next speaker is Coach Raphael Sarmiento. So he is a registered nurse, but focused his calling towards helping people through fitness. He is a certified personal trainer with on-hand experience in different commercial gyms, locally like Anytime Fitness and Gold's Gym. He has been the head coach of the fitness gym of the Medical City for a number of years now. So kindly reserve your questions for at the end of the lecture and just type them in the chat box. So let's start to listen to their lectures.
Thank you, Kat, for that wonderful introduction. Welcome everyone for another episode, actually the last episode of the Lunch Date with Your Wellness MD. So as Kat has mentioned, today's correct title is Staying Physically Fit During a Pandemic. And I'll be tackling about I'll give you an overview about what is physical activity and what is physical fitness, why we need to do it, and what you need to do to prepare for it. Now, Coach Rap will be coming in on the second part, and he'll be explaining the process in starting an exercise program to an individual, and also to give a demonstration of an exercise program that can be done at home and anywhere for that matter. So let's begin. I'm showing you this slide to illustrate movement or motion, although it's a still picture. Now, movement is dependent on several organs for locomotion, namely your bones or your skeleton, which is the framework or the foundation of your body, along with several of its attachments. And the most significant attachment is the muscles. Actually, they initiate the act of moving by contracting or relaxing in groups. Now, the other supporting structures are your tendons and ligaments, and they actually serve as a bridge or connectors from your muscle to your bones and vice versa. So movement allows your body to perform physical tasks, and this process requires energy. Excuse me. So what makes movement difficult? Number one, the effect of gravity. Number two, the effect of weight and gravity. Three, your inherent baseline strength of your body. So if you're not regularly moving, it'll be difficult for you to do many physical activities like climbing stairs, for example. Number four, effect of certain diseases such as stroke and heart attack. This renders the body really weak to carry out even normal day-to-day tasks. So doing physical activity in an efficient, effective manner is what we call physical fitness. And traditionally, physical fitness is a prerequisite to survival. During the younger years of our planet, we used to hunt and grow our own food. We used to traverse long distances by foot to find adequate living conditions for a family to settle in. People during the day used to be very nomadic. And all of these require a person to be physically fit. And of course, when one comes face to face with danger, being physically fit greatly helps a person escape certain death. So as time passes by and with the onset of changes brought about by industrialization, we come to enjoy so many conveniences in life that's supposed to support the present economic framework for a person's survival, which is to work hard, to earn money, to provide for our basic needs and other luxuries for our families. Food, for example, has turned out to be very convenient for the busy corporate individual. You see fast food, food delivery, canned foods. It's so easy to get food nowadays, unlike before when you need to farm and wait for it before you harvest it. So we started off pretty well with the evolution of man from primate to an upright, intelligent, hardworking human being. But as we continue on with the present time, we're slowly reverting back to our ancestral posture. This is what I would call road to devolution. Because despite reaping the benefits of a convenient life, we have apparently turned into an inactive and sickly kind of species in this planet, primarily because of the non-communicable diseases that I lectured last week. Well, imagine this common scenario. Wake up in the morning, you prepare for work, breakfast, take a bath, dress up, you ride a vehicle to work, and then at work you sit for around 8 to 12 hours, then riding a vehicle again, going back home. And at home, we sit on our dining table, we eat our dinner. After that, have a conversation or play with our children. Maybe after that, when kids are asleep, you sit on the couch, watch Netflix, and maybe eat again. Then after that, when we get sleepy, we lie down on our beds, only to wake up and repeat the cycle 5 to 6 times a week, every month, every year. As we grow older and older, then we notice we get heavier and heavier. Then we start to feel some heaviness in the shoulders, the neck, the lower back, that eventually leads to muscle aches and pains. That further makes us, that makes us feel lousy, irritable, and more lazy to move. And before we know it, our blood pressures and blood sugars and cholesterols are on the high side. And some don't even know it because having all these metabolic parameters in this array doesn't normally produce any symptom. And then when symptoms come, that's when we get sick. So that's actually very sad. No? We earn money through only to eventually spend it on healthcare down the line. I don't think it's the right way to live. We don't live to work, but we work to live. Sounds cliche-ish, but it's very true. And if your lifestyle is similar to what I just mentioned, then I challenge everyone, all of you, to rethink and reflect on changing. Because viruses like COVID-19 would take advantage of that particular issue that we have. So why is it important to stay physically fit during this time? These are the many, many benefits of having regular physical activity, not for both adults and older adults. So in general, exercise decreases your chance in getting these listed conditions on the right side: type 2 diabetes, cardiovascular disease, depression, dementia, falls, etc. So as you can see, the risk reduction, very, very significant. Exercise also improves sleep by creating a deeper sleep pattern, and individuals fall asleep faster when they exercise. According to an expert in Harvard, the benefit of exercise on sleep is because exercise is a controlled stressor on the body. The brain therefore compensates for the extra physical stress of exercise by increasing the depth of sleep of that individual. Exercise also maintains healthy weight. So exercise is an adjunct to any weight management program. But successful weight management programs are dependent mostly on nutrition than with exercise. I like to make that very clear because apparently there's this misconception that just exercise alone without actually modifying your diet, you can lose significant weight. So about 70 to 80% of a weight management program success is due to nutrition, and roughly around 20-30% is due to physical fitness. You can never outrun your form. Many individuals may contend that they can lose weight with only exercise. Maybe true for some, and to a certain degree, but I would imagine the intensity and frequency is much greater than what would be recommended, which I will show you later. Exercise itself is a stressor, but a controlled kind, as I mentioned earlier. You only limit it to a couple of minutes a day, and as long as things such as nutrition and sleep are adequate and optimal, then exercise increases your body's capacity to handle stress from whatever cause. Overall, all these can result in improvement in your quality of life. So those are the they're very good benefits for exercise. Now, also, I highlighted this slide last week when I was explaining the effects of COVID-19 to our overall health. And apparently, looking at different studies from China, the US, and Italy, These are the risk factors for getting severe form of infection from COVID-19. Number one is a weight problem. The higher the weight, the higher the risk, as exemplified by the BMI, and the presence of the non-communicable diseases that was mentioned earlier. So heart disease, stroke, hypertension, blood sugar problems, blood cholesterol problems, and lung disease, chronic lung disease. I'm showing you here, that these NCDs that I mentioned are highly dependent on metabolic indicators such as weight, blood pressure, blood sugar, and cholesterol, which is highly influenced by all these behaviors. And to highlight in particular, physical inactivity. And showing here the different common risk factors that may lead to the major non-communicable diseases. So based on the WHO data back in 2003, physical inactivity may either prevent or promote all these 4 common NCDs. And according to a 2008 study, a local study, it has been found out that at least roughly around 76% of Filipinos living in the urban cities have inadequate physical activity. So what do we mean by inadequate or adequate physical activity? So before we dwell into that, I'd like to differentiate the different kinds of physical activity. Because when we interview patients in clinics, when we ask them about exercise, some would say that they do exercise and they say it's washing the car or gardening or cleaning the house, doing house chores. And some would even say pag-aalaga ng anak, paghahabol. They're actually partially true because these activities are what we call non-exercise or lifestyle physical activities. Main difference with exercise one, it's basically unstructured. There are no sets, no reps, no time. It's basically untargeted, unfocused. But it's still a type of activity that lets your body perform a series of movements that utilizes energy as a result of the following, muscle contraction, elevated heart rate, and breathing, the degree of which may significantly vary depending on the activity. Now, exercise, on the other hand, is a structured kind of physical activity that's deliberate and focused on achieving consistent results. And there is normally a format to be followed. There are sets, there are reps, it's time-based, intensity is also controlled, and by doing so, we can accurately track progress and achieve an intended end result, be it increasing endurance, increasing muscle strength, increasing treating injury, helping recovery or rehabilitation, also adjunct for weight loss programs, and can also increase sports performance. Okay, so this slide is showing the different kinds of physical activity. Let me just point that, exercise, which is more structured, and non-exercise physical activity, and showing the different levels of intensity, low, moderate, or vigorous. So, for example, for exercise, pwedeng sit-ups, pwedeng push-up against the wall, that's an exercise that's low intensity. An example of an exercise that's vigorous, fast dancing, fast swimming, doing tennis na singles. On the other hand, non-exercise physical activity that's low intensity may be washing the dishes. Tayo ka lang, on your arms lang gumagalaw. Kapag vigorous, ayan, yung paghahabol o paglalaro with your kids or with dogs. Pwedeng vigorous activity yan. But I need to tell you na don't take this as pikahon. Not everyone is on the same page. Every individual has his or her own baseline capacity for exercise. Iba-ibang levels po ang physical fitness. So hindi po dapat tayo nakakahon sa programa. So some individuals may do stair climbing very easily. So for them, it's a type of non-exercise physical activity that's low intensity. Yung iba naman, akit ng hagdanan, sobrang hingal na. For them, that's vigorous. So how do we individualize physical activity intensity? How do we determine? So I'm going to explain to you the talk test. You can do this anytime want to try a physical activity. So when you're doing the activity, if you're able to sing and laugh, that's low intensity. If you're able to utter a single word, that's vigorous. And when you're able to talk in phrases, it's difficult to talk, pero you're still able to, say some words. So that's moderate. Whatever activity you're doing. So that's one way. That's one very simple, very practical way in determining exercise or physical activity intensity. Okay, so this is a very full slide, but sa lahat ng slides na papakita po namin, ito po yung tandaan nyo. So there are different kinds of effects of exercise or types of exercise depending on its effects. One type of exercise is actually increasing heart rate and breathing. It actually develops your cardiopulmonary system. And these are usually aerobic activities such as jogging, running, cycling, and swimming. Yan. So ang recommendation po nito, according to CDC or the Center for Disease and Control, Center for Disease Control and Prevention, CDC, is 150 minutes a week. To make it, to visualize it, that's like 30 minutes for 5 days a week of moderate intensity, or 75 minutes of vigorous intensity, or let's just say 15 minutes, 5 days a week. Okay. Now, there are other activities that can also develop physical fitness, such as building strength by lifting weights. And lifting weights doesn't necessarily mean nabubuhat kayo ng barbell or dumbbell. It may be just your body weight. And actually, for some patients, mas mahirap na ang magbuhat ng sariling body weight depending on the exercise. So you build strength through that. There's also a kind of exercise that improves balance. And these are the types of exercise that is more centered on proprioception or flexibility. And you do these types of exercise, the ones that improve balance, for example, like dancing and Tai Chi, are really recommended for the older age group because when the older age group individuals ng mga 60 to 65 and above are really prone for to falls. And especially for females who are postmenopausal during that time, it's really about the risk of having fractures due to falls. So in order to prevent that, it's actually not just about, of course, nutrition plays a big part, but also to increase your bone density by doing exercises like this. Okay? And also exercising that prevent falls specifically. So for strength activities and activities that improve balance, 2 times a week or more, involving all major muscle groups, the legs, hips, back, core, your chest, shoulders, and arms. All right, so moving on, during pre-COVID and in the past decade, we see more individuals becoming aware and engaged about their health, and they're the ones who actively participate in activities that promote fitness. So, marami pong mga gyms, nagsulputan in the past decade. Marami rin po naglalako o nagpa-participate sa mga fun runs. However, because of COVID-19 and the quarantine protocols that resulted from it, we can't go out. And facilities that, like for example, the gym that gather crowds and groups are required to shut down or to close temporarily. So we are left with very few options to become physically fit amidst the greater tendency to become sedentary. So stay at home, work from home, and you're basically sitting the whole day. And since you're at home, you're more comfortable there. So there's a tendency to really lounge around, sitting in the couch, watching TV, use your mobile phones because you can't go out and meet your friends. So you communicate with them through social media. You tend to, your anxiety, some people would just really drown themselves in video games. Again, to stress, not smoking, the new smoking is sitting. So there's that tendency really to do all these things while at home. So this slide, in this slide, we will show you the 3 steps from moving you from couch to the winner's podium. All right, so let's start. The first one is actually planning. It's a phase of change where the involved person is already thinking of changing about his or her behavior soon. And that soon is roughly within 6 months. No? And it's towards a health-driven goal. In this case, it's physical fitness. No? Now, after that, the person moves towards into preparation. And please do not skip this part because this part would entail processes that will ensure your safety. So one, you have to make sure that you're medically cleared to do an exercise program. And this might require you to seek medical counseling with your doctor. No? Nowadays, you may not be, you need not be present physically. Because of COVID nga, we have learned to communicate remotely, you know, through teleconsultation. You can do that. No? I'll give you certain scenarios why you need to do this medical clearance before you undergo a structured physical activity program. So for example, if you're a diabetic on insulin and plan to exercise upon waking up before breakfast, baka mag-hypo po kayo kung hindi po yan na-adjust ng inyong doktor. If you had a previous knee injury na hindi po kayo nagpatingin at hinayaan nyo na lang gumaling. So, and you plan to, for example, do a triathlon or run a marathon. So you have to have that injury checked. You have recovered from a previous severe illness, like a heart attack or stroke, and has not exercised since then. So visit your cardiologist or neurologist for that. Or you don't know your current state of health. No checkups at all from the start. So these are the scenarios wherein you really need to visit your doctor to get a medical clearance for you to actually undergo exercise. Number two, you have to have the proper equipment for exercise. I'm going to stress the importance of equipment, particularly shoes. You plan on doing aerobic exercises kahit sa bahay lang po, no? And sometimes, if you do it barefoot and you're not really a seasoned exerciser, then you might run up with injuries that might involve the ligaments or supporting structures of the foot. So having adequate footwear is actually is recommended. When you exercise, always have water in hand and always be hydrated beforehand. I will not dwell on the nutritional preparation for this. This may be tackled on a different webinar. And then number three, please make sure you have ample free space. So don't exercise when you're going to do jumping jacks, you're going to move side to side and shuffle, kung itatamaan kang babasagin and all that. No? And also be very mindful of the people at home, especially children. Okay, so I don't want to share horror stories, but please be careful if there are children in the house. Okay. Now the last step is what we call perform, also known as just do it. And for this, I will turn you over to my co-presenter today, Coach Raphael Sarmiento.
So before, when we are in the fitness center, before we go with the client's goal, we know first, knowing the client's goal, history, and ability are a must for designing the right program. For a client's successful achievement, we want to know what to work, how often, and how hard it is for them. Because the body only adapts to physical demands, not only on the intentions, but on the actions itself. So first, know your client. You should build rapport first. So it's a client and PT relationship goal to have a building trust when it comes on the exercise itself. When you design the program, you should focus on the client interests. You put always the client interest on top of all what he needs and what he wants. Knowing what they want and also what they are seeking is our first large fund. The history, we seek for medical and past and ongoing medical conditions, surgeries, and medications or supplementation that they take before we initiate a program. because this can affect any of the program design that we mostly introduce to them on their first month of exercises. Next is apply the fundamental principles of simplicity, specificity, and progressive overload. When it comes on the simplicity, the word itself, make use of the simple program or the basic exercise workout that they can tend to do so. For example, when they do upper and lower exercise, you have to determine whichever first that they can do or not. First, you have to ask if they have any past medical injury or any surgeries before we execute any exercise program to avoid any further injuries on the muscle itself. Next is the specificity of the exercise. You have to know the specific exercise, what they want to execute first, like for example, loose weight management, toning, strengthening, or any sport or health type exercise execution before we build any exercise program. The next is the progressive overload. This is the type of progressive overload that we increase the load, the volume, the repetition, the set that is required for a measurable required exercise to keep clients progressing. So to make sure of this, we have to record and save our data for plan of action that we can most probably set it for like 3 to 6 months of program. Our next is the perform and needs analysis. The perform needs analysis is make sure that we have to make the performance assessment or a somewhat we call fitness test. You have to determine which is a strong and the weak side of the capabilities of your client. Or to do so, you have to test yourself and record it. For example, like Monday, you do some exercise like push-up 10, then you record it next week. Maybe you progress like 15 to 20. So that's a performance analysis, and that's what you keep track on your progression. Creating a program skeleton. This is a scheduling of your exercise program routine. Like, for example, on a weekly basis, like Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, Sunday. Like, for example, for me, Monday, I do hypertrophy training or strength training to build up muscle. Monday, upper body. So, for example, my chest. I do it only on Monday. So then the next day, Tuesday, I do it on my lower to keep rest on my upper body to give assumption of muscle recovery. And then more Wednesday, for example, you do some rest for your whole body to recover itself. And then for the next day, you do it again for another muscle group. Plan the warm-ups and cool-downs. Warm-up is very essential for us to avoid first the injury itself. The next, to prepare your body for movement and also increase the blood flow for the muscle train. And for cool-downs, usually to avoid venous cooling or to prevent any body temperature or heart to return to the normal values. Select and order exercises. To select and order exercises, we determine the effectiveness, the relevance on how many, how long, but itself, we need to do it for the quality, not the quantity. So assign sets, reps, and rests. On the first time, we do it low to moderate exercise for the beginner or the novice phase. We progress on the moderate to advanced phase, determining on what their program or exercise routine. Make a plan of progression. The progression part is the hard part because we have to maintain it for like 6 months onwards to progress for our clients to determine on the progressive load that we have to. On our next part, I would like to introduce my training buddy, my friend, and also the walk the talk model, Dr. Christian Flores here, as you can see. So we'll be introducing some basic workout at home that you can do anywhere at your home, that there's a place or very spacious place that you have also a mat for exercise execution. If you have something that very comfortable place, you have to put it there. So First, we have to do dynamic warm-up, just as before, to avoid any injuries and prepare your body for movement. As shown, jumping jacks for 20 seconds. Let me introduce Dr. Flores doing the jumping jacks for 20 seconds. You can further introduce like 30 seconds or 45 seconds after 2 to 3 weeks of progression. The next is slow jog in place. Go up. Yes. Very smooth. If ever you want to rest in between of the exercise to recover, please do so and keep hydrated as you do this exercise, because this is a cardio exercise that will sweat you around, just like me. And the next one is slow pace, high knees, 20 seconds. If you can do it more progressively, faster than the slow pace, much better. So there's the slow pace, high knees for older adults. And then the last one is alternate boxer punches to prepare your upper and arms movement. You can do the dynamic warm-up for 3 sets or 2 sets, depending on how you determine your exercise. So we'll be doing bodyweight exercise program. So sorry for that. Our next is bodyweight exercise program, squat. I think all of you are familiar with the squat, bodyweight, just like that. If ever you need some support, you can hold on to something like a chair or maybe something that is very near to you, like the chair there or the wall, you can hold on to it. The next one is a push-up. For the beginner type or a lady or a female, we can do a regular knee push-up. Just half of your body, your legs is going up. Or if ever on a male is a military or regular push-up, you can do so. Just like that. If ever you can see Dr. Flores doing it, he can do a lot, like 50 push-ups in one set. So you can do also a wall push-up. This one is for our upper body to make our shoulders broad or add muscular strength on our triceps and also our back. It retracts our back and movement on your body. So elbow plank to engage your core. This is good for our abdominal and lower back muscle. Get up. So our next is our elbow plank. You can hold it like 20, 25, 30 seconds for beginner. If you do so like 45 to 1 minute, mostly that's for advanced. Then next time we progress it like a moving exercise. We add some hands and arms exercise, but right now we can do like elbow plank. Next time is the hip bridge hold. This is good for your posterior chain muscle. It improves your lower back, your glutes, and also your hamstrings. And then the next one is the leg raise exercise. You can do like 5 times per side on your first week, or you can like do it like single leg per side, or the modified one is the knee raise. If you can do like leg raise, you can modify it into a knee raise. The last one would be Superman plank to improve your posterior muscle on your upper body. You can do it like 30 seconds, 20 seconds, or you can do it like by reps, 10 repetitions. After doing like 2 to 3 sets, we head to the cool down stretches. That's our finisher exercise. You can do like cephalocaudal from head to toe, head stretch, up and down, 18 seconds per side. Head stretch left and right, 18 seconds per side. Shoulder stretch upward. You can do it 18 seconds, and also you can do 18 seconds shoulder stretch downward. Then the last one would be your triceps and arms for your lats and side, 18 seconds. And for the last one is your shoulder and arms, both 18 seconds per side. And for our lower body, we could do like squat stretch for your hamstring and also your quads. If you need support, you can hold to something just to maximize the cool down stretch. And the last one, you can do knee hug, standing, or you can do even so lying down. And then the last one would be your ankle dorsiflexion and plantar flexion. 18 seconds per side. So that's all for our basic workout at home. This COVID and after COVID, you can do this exercise at home.
There.
Hello. Oh my gosh. Sorry, that will be the
Okay.
first and the last that we were going to do it outside at noontime. Sobrang init. Sorry, because we don't have any other venue actually to do it. So you were forced to actually do that portion outside. Anyway, so I think that's the last segment. And for any questions, please feel free to ask now.
So the question is, how can you modify the basic workout for people with scoliosis?
Hi, ma'am. Thank you for your question. This is for Emil and Amy.
Yes.
So, we modify the basic workout with people with scoliosis, intending on their back problems. But before we do so, we ask for the clearance first before we create a program design for that. But most of the exercise for scoliosis, we intend to do it with proper exercise regarding the postural analysis first. We check first if it's like progressing or not. If it's progressing, we don't exercise with it and then we refer it to the physical medical rehabilitation or the doctors for the physical rehab.
Okay.
I think there's another question, no?
So regarding the ideal target heart
Oh,
rate,
sorry.
so the maximum heart rate is like, this is the formula with it, like 220 minus your age. This is ideal regarding your age. Like for your target heart rate regard when it comes on doing cardio, you minus it with your age.
Okay, so I'll add to that, Coach Rap.
Yes.
Remember the earlier slide I showed you about determining intensity of exercise, whether it's slow, moderate, or vigorous. And I told you about how to personalize it practically using a talk test. Now, Coach Rap mentioned you the maximum heart rate, the 220 minus age. Now, you multiply that with a percentage target heart rate, depending on the programming, whether you want it low intensity, moderate, or vigorous.
Yes.
So normally there is a range. So for example, 55 to 65% of your target heart rate would be low intensity, 65 to around 75 would be moderate, and 75% of your target heart rate and above would be vigorous intensity. So that's normally the more accurate and objective way in determining the intensity of an exercise. So with that, actually, it's advisable if you're that objective in finding out your target heart rate. So you determine that, for example, I want to run, but I want it moderate. So you determine your target heart rate and multiply it by, for example, I just want it around 65% of my target heart rate. So let's just say it's around 135. So all throughout your jogging, your exercise, your running outside, you have to have some sort of like a monitor, a heart rate monitor, to find out your average, your heart rate during the time that you're doing the exercise. And at the end of the run, for example, gadgets like this is a Fitbit, will actually tell you your average heart rate in the end. So if your average heart rate falls on the target number, like for example, around 135, then you have achieved your goal. So this actually makes it, determining heart rate makes it more, makes your training program more predictable. Coach Rap?
Hi. For late
Yeah, there's a question out.
For the first few weeks, you have to start walking and then a slow jog. Walk to slow jog. About 2 to 3 times per week. Walk to slow jog. 30 minutes to 45 minutes is the advisable for this one. 2 to 3 times per week.
Okay, so to add to that also, there is no one best cardio exercise. Again, it goes back to how much impact or intensity of an aerobic exercise you're doing. Actually, you may do, for example, a very fast set of jumping jacks and achieve the same intensity or target heart rate as if you're running in a treadmill. So it really depends on the type of physical activity or exercise, or the type of or the intensity of the exercise. Pero basically, if you're going to do exercise anyway, might as well do an exercise that can elevate your heart rate to a high enough number and yet work out all your body parts. One exercise I would think of that can do that, but is actually used by advanced exercisers, would be a burpee. So if you know a burpee, then you know how it's done. And if you yourself have done a burpee, you would actually know it targets almost all your body parts, and it can raise your heart rate so high very fast.
Thank you for that very wonderful lecture, Dr. Flores and Coach Rap. So that has been our last episode in this series. But rest assured that it doesn't stop here. We will try to make more webinar sessions like this. So in behalf of the Wellness and Aesthetics Institute of the Medical City, thank you all for attending, and stay safe. Thank you.
Thank you, everyone. Thank you for attending. God bless you. God bless you.